Hello, I'm Dr. Chin, and I'm here to talk about prostate cancer. Prostate cancer is now the top cancer in Singapore men. Most of these men are above 60 years. High-fat diet is the main cause, as only 9% are genetic in origin. There's usually no symptom when the cancer is in its early stage. By the time the symptoms appear, they are similar to men with enlarged benign prostate, namely slow stream, frequent urination, dribbling towards the end of the stream. By the time the cancer is advanced, it will cause fatigue, weight loss, and bone pain. Cancer is suspected when the tumor marker PSA is above 4. However, infection and non-cancerous prostate enlargement can also raise the PSA level. So the only way to confirm cancer is through prostate biopsies. MRI is now done prior to biopsy to target the suspicious area through fusion with the ultrasound images. Treatment choices vary from active surveillance, surgery, to radiotherapy, depending on the stage of the cancer and the histology. Surgery still gives the highest cure rate, and the robotic method is the gold standard because of faster recovery of continence, better preservation of potency, and a lower recurrence rate. So if you get prostate cancer, please do look for a urologist who is trained in robotic surgery.